I'm gonna go get some water. Hey, Ricardo.
Hey, how's it going?
Good. How are you?
Good. I've been I was talking earlier about I have the puppy here and my partner's out doing care packages.
Okay.
And so normally when I'm on the camera or when I'm doing any kind of conference call, we have two and he's very young and so he's chasing the older one around and they bark when they're doing that. And normally she keeps them in line with on TV. And right now they haven't been adhering to that. I had an interview earlier today, and he jumped on my lap in the middle of it. So we'll see what happens. He's sleeping very comfortably, about 3 feet away. And we'll see if in the middle of this here he decides that he wants to cause a ruckus. Right? Yeah, Gideon.
Yeah.
It's good. He gets tuckered out. He's growing his adult teeth. I didn't know dogs lost their teeth because my rescues were never puppies.
Oh yeah.
And so he's my first puppy rescue. And apparently they lose their baby teeth and they grow their big teeth and it causes them all kinds of discomfort, just like a regular child. And so he's in that process right now, but he's been very good. I'm very happy to have him.
Good.
He's made the quarantine a little bit brighter for me.
Yeah. No, they're great company.
Yeah, and he's smart. I've gotten him trained on a couple different things. He's fully house trained, which has been phenomenal.
Yeah, that's good.
I can't train him to leave his sister alone though, so there's anything I can do for that. How are things on your end?
Going well. It's busy nonstop. But it's
you have children, right?
Yeah. What's that?
You have children, right?
Yeah, I have two. Yeah.
Are they school age?
Yeah, two teenagers. One's a senior in high school. One's in 8th grade.
Oh, senior in high school this year is pretty hard.
Yeah, so she's just finishing up. And my son's going into 9th grade. So.
How are they handling the quarantine?
No, it's tough. It's tough for kids. The homeschooling is it's challenging for everybody.
And you can't really hang out with your friends in a physical sense.
No. Our house is small too, so there's no place you can really go to be by yourself if you need some downtime,
Yeah, no, I'm fully. Nobody's house is as big as they thought it was. I'll tell you that.
Yeah. We manage. a lot of people have it worse than we do, so. can't
Yeah, I
com-
think it's good that, I think when you have a family unit, that's been the toughest part for me. My family, we used to meet every week, right? We'd have different things we'd be doing. We're a big family, and that's all kind of stopped. We do Zoom calls, which is not the
Okay,
same, but
yeah,
has,
yeah, same with us. We usually try to meet up every week, but we haven't done any of that either.
yeah, it's interesting. But you know, we're treating our parents with kid gloves, so
Yeah, yeah.
they're locked up basically.
Councilor Arroyo, we're live and ready whenever you're ready to gavel. Just let me know.
Who's that, Kerry?
Yeah.
Yes, sir.
How are you, sir?
Good, Councilor. How are you doing?
I'm doing fine. Good to hear from you.
You as well. Thank you.
So I see Councilor Flaherty is also on. Usually the way I do this, Councilor, if you just unmute or raise the hand when you're ready, if you have a question or anything like that, or if you would like an opening statement, that works. I don't know if you want to have your camera on or off. You don't. Either way, I think is fine. But
No
just
problem.
it's hard sometimes because there's no camera to know whether or not folks that are muted have any questions or want openings. So when that happens, if you do want it, just do the little blue hand thing or unmute yourself, and I'll notice that you unmuted yourself, and I'll shoot it right your way.
10-4, I can hear you loud and clear, and I'm going to be transitioning from home computer to my vehicle, so, and I'll be tuned in from the car. So thank you, appreciate it.
No problem. And then just if you unmute, I'll know that Michael Flaherty has some questions. If you don't, then I'll leave it on unmute and go to the next one.
Hey, Ricardo, it's Kim. I'm here. I'll use my blue hand.
Okay, that's perfect.
Are you keeping track of the order, though?
Generally speaking, yes. I have that written down, but the way I try to do this is sometimes folks, because it's not budget hearing, some folks are there to just listen and learn, and some folks have questions. Rather than go, hey, do you have any questions? And they might be present or not. I like to just see if they raise their hand. I know they got a question, and then I'll take those in the order of arrival, if that makes sense.
Well, I have questions, and I don't know what the order of arrival is.
So I can tell you right now.
I assume you're taking the lead sponsor first.
Yes, and she also happens to be the first one in, other than me.
Okay.
And so it'd be me, Councilor Braden, then Councilor Flynn, then Councilor Flaherty, then you.
Okay, perfect. I'll go after Michael. Thank you.
No problem. Thank you.
All righty, thank you. I'm going to be on mute until such time.
All right, so it's 2:01. 1 second, we have one more guest that I can see that's a speaker that's joining us. So we have quite a few speakers here today, guests. We're going to go ahead and get started. So my name is Councilor Ricardo Arroyo. I'm the Chair of Public Health, the Committee on Public Health. I'm joined by my colleagues, Councilor Braden, Councilor Flynn, Councilor Flaherty, Councilor Janey, and I believe at the moment that's it. As folks show up, I'll make sure I intro them. I want to remind everybody that this is a public hearing. It is being recorded and will be rebroadcasted on Comcast 8, RCN 82, and Verizon 1964 at a later date. It's currently being streamed at boston.gov, City Council TV. We will also take public testimony at the end of the hearing. If you are interested in testifying, please email Ron Cobb, that's RON.COBB, boston.gov. He'll send the link and follow along on the live stream to know when it's your turn to speak. Please state your name and affiliation, residence, and limit your comments to a few minutes to ensure that all comments and concerns can be heard. Today's hearing is on docket number 0560, which is an order for a hearing regarding the social impacts of COVID-19 pandemic response measures relative to domestic violence, social isolation, and mental health. And with that, I'll start with opening statements. I'm grateful to Councilor Braden for calling for this hearing. This is an important issue. And this is a great way to address it and make sure that we have those resources provided to our community and any information that we have. The way that we're going to do this is I'm going to provide opening statements for any counselors that are here that wish them. And we're going to try and limit that to about 5 minutes. I'm then going to flip it to our guests. We have a number of guests who specialize in one or two of the specific things that we're speaking on today. I'm going to let each of them get 5 minutes to 10 minutes to answer sort of the prompts that I'm giving them. And then I'm going to open it up to questioning after they've all spoken, so that when you're asking your questions, and I'll give everybody 5 to 10 minutes on that, when you're asking your questions, that you address them to a specific person, or you can ask them. And if any of our panelists feel that they want to answer that question, just raise your hand if you're on camera. If this isn't your first Zoom hearing, there's a blue button on the side, the blue raise hand button. You can raise your hand if there's an open question to the group and you want to answer. Do it that way, and then we'll do it there. Councilor Mejia has joined us. And so as we go forward, I'm going to try and keep all that in control. I do ask that people self-time themselves to take value of other people's time. And with that, I'm going to now pass it over to Councilor Braden, who called for this hearing, to give her opening. Thank you, Councilor Braden. Are you muted? 1 second. There you go.
Got it.
Now you're muted. Yep.
We're all learning as we go. Thank you so much, Councillor Arroyo, for expediting this hearing today. I also want to thank all the central staff who, behind the scenes, who are facilitating this this approach. Lots of folks are working very hard to make this accessible online and so that we can continue our business. I also want to thank all the panelists who have agreed to come on this afternoon and talk about the impacts of the social and emotional impacts of the COVID crisis on some of our most vulnerable neighbours. I'm very, very grateful for all of you for your participation. And I hope at the end of it that we will have a broad ranging discussion this afternoon. But at the end of it, that we will be able to produce like a guide or a resource guide with information to share more broadly after this hearing. With no more to say, I feel that there's so much focus on the real immediate physical needs of our neighbours, food, shelter for our school kids to get them Chromebooks and continue their learning. But we need to also turn a lens and look at the mental emotional impacts of this crisis, and both now and then also going forward into the future, how this might impact the long-term mental health of our neighbours. Thank you so much.
Thank you, Councilor Braden. Councilor Flynn, if you'd like an opening statement.
Thank you. Thank you, Councilor Arroyo, and thank you to Councilor Braden for bringing this forward, and to Councilor Braden for your leadership on this important issue. I had the opportunity over the last 2 years to work with Councilor Campbell on domestic violence related issues and the impact it has on families. So I'm glad that Councilor Braden is continuing this discussion at this critical time. During our hearing that we had on domestic violence, we listened to panelists talk about their experiences and their clients' experiences as well. In one aspect of, social isolation and domestic violence that I've tried to focus on was the impact it had on people in our immigrant community and women, people with language access challenges as well. I met several times with the Asian Task Force Against Domestic Violence, and during their conversations with me, I asked them what their major concern was, and every time they always said to me, it's language access. So, making sure we have the services for our immigrant neighbors. We have services for, services for people that may not speak English, so that they can get the services that they need, but also critical to work with, first responders or social service organizations to make sure that they know exactly what to do as it relates to working closely with our immigrant community as well. So again, just want to say thank you to the panelists for being here, for testifying. Thank you to Councilor Braden, and thank you to Councilor Arroyo, and thank you to Councilor Campbell as well for working with me on this issue for the last 2 years as well. Thank you.
Thank you, Councilor Flynn. Councilor Flaherty.
Thank you, Mr. Chair, and I want to obviously give a shout out to the lead sponsor of this as well for one for you for calling the hearing, two for Councilor Braden putting it forward with respect to the mental and emotional impacts. Seeing it playing out in my own family, obviously with social isolation, watching my dad, who's 84, living alone, and my brother and sister and I were constantly on the phone trying to make sure that he has everything he needs, and doing the sort of the drive-by and wave out the window. It's been somewhat traumatic for I think us, and for our children. So, and also to footnote the council's efforts last week putting forth a resolution recognizing the month of April as child abuse awareness, and add that in with domestic violence as well as drug and alcohol abuse. There's lots of things that are going on in people's homes right now, and because schools are not out, schools are not in session, and we don't have sort of teachers on the front lines making observations, as well as other medical and pediatric officials. So a lot is sort of being missed. So this is a very timely hearing. I look forward to hearing from the experts. Appreciate my colleagues putting this forward, and look to learn a little bit more as to ways that we as a council can partner with the different organizations and associations as to what can we be doing during our COVID response to make sure that whether it's a situation of mental and emotional impacts, social isolation, domestic violence, child abuse, drug and alcohol abuse, all the things that we've always worked together on and have put a shoulder into, those things sort of seem to be taking sort of a back seat during this time. But we need to make sure that we're raising these issues and lifting up some of those problems that are happening within people's homes, and find ways to connect folks to resources during these difficult times. So appreciate the opportunity to give an opening, and look forward to hearing hearing from the experts. Thank you, Mr. Chairman.
Thank you, Councilor Flaherty. Councilor Janey.
Thank you so much, Mr. Chair. I want to give praise to the maker for this very important, very timely hearing. We've been, discussing the health impacts in terms of how many cases, who's recovered, et cetera. We've been talking about the financial piece, but really looking at the social, emotional piece, the mental health piece, really, really important. I'm really worried about, especially with the stay-at-home advisory, most likely it will, perhaps be extended. All of the folks who are home, whether young children at home in abusive situations, whether women or others, anyone can be in an abusive domestic violence situation. So certainly worried about those who are stuck at home in this stay-at-home advisory with their abusers, where before, going out to work was that safe haven. Going off to school might have been that safe haven. And now folks are really trapped at home. I'm also worried about, depression, increased alcohol use, social isolation. And so while we're all at home, really important that we stay connected. And I think this is just a really important hearing, and gives us an opportunity to understand what is happening, what kinds of calls are coming in, what kind of cases we're able to track, how we're able to support, what services are being offered. So again, I just want to say thank you to the maker, and I look forward to a productive discussion.
Thank you, Councilor Janey, Madam President Janey. Councilor Mejia.
Yes, good afternoon. Thank you, Chairman Arroyo, for hosting this. And I also would like to thank Councilor Braden for bringing this to the forefront, and looking forward to listening to those who are living the realities and doing the work to inform our thinking. Just a few things that I just want to uplift is when we're talking about social and emotional well-being, it's important for us to recognize that there are also a lot of young people who are sitting in homes right now that they didn't feel safe to begin with. And what can we do to ensure that we're creating spaces for people to have outlets, whether it be through a helpline or virtual places to disconnect. I think it's really important for us to think outside the box during these times. And when it relates specifically to mental wellness and domestic violence, I do have to agree with my colleague, Council President Janey, about the issues of domestic violence and isolation and depression during COVID-19 is just at a heightened alert, but people are suffering in silence. And how do we create spaces for this conversation to be uplifted? So looking forward to engaging the dialogue, and just want to plug really quick that we are hosting a mental wellness check-in with young people this week on Thursday. And I think as we continue to have this dialogue, really making sure that people who are leading these conversations are folks who are culturally competent and responsive to the needs of all, and all means all. And thank you again for this opportunity to share opening remarks.
Thank you, Councilor Mejia. I'd like to acknowledge that Councilor O'Malley, Councilor Campbell, Councilor Anissa Asabi George, and Councilor Wu have all arrived to this hearing. I'd like to give them the ability to give opening statements in the order that I saw them appear. I'm fairly certain it's the order of appearance. And so, Councilor O'Malley, if you have any opening statements.
Thank you, Mr. Chair. Thank you to our dear colleague and friend, the Alston Brighton District Councilor, Councilor Braden, for her leadership on this. I know this wasn't her maiden speech, but this may be your maiden hearing, Councilor Braden. So well done on something that is incredibly important. And obviously, we're gonna discuss the myriad issues here. I've been talking to folks from the Los Police Department. It's not anecdotal. We are seeing concrete evidence of an increase in domestic violence incidents. We want to make sure that we're equipped and prepared to offer supports to those living in dangerous situations and unsafe situations, every support that they so desperately deserve and need. As it relates to other mental health supports, how are ways that we can work to leverage telehealth as it relates to access to services, be it a social worker, a psychologist, or psychiatrist, or some mental health clinician that can help. There is no question that anxiety levels, depression levels, so many mental health issues that all of us as a city collectively are dealing with now are obviously exacerbated by what we're up against with COVID-19. And with the significant ways that we're addressed that. And then finally, as it relates to social isolation, this has been something that I've been particularly focused on in my district. We've been calling through to senior citizens. We're on our second go-around, nearly our third go-around of all senior citizens in the district that boasts the highest percentage of that. I've also been working, I want to thank all of my colleagues to their support as it relates to supporting those seniors who are in independent living situations, quite often on campuses of skilled care facilities or nursing homes. These are individuals who are older, who live alone, but would not necessarily have the same access to testing or other supports that is governed by the state. So that's one thing that we're all focused on. I'm really looking forward to hearing from our experts and most importantly, hearing from members of the public to have concerns. But thank you again, Councilor Braden, for this obviously very, very important hearing. And it's great to see all of you, albeit remotely. Thank you.
Thank you, Councilor. Councilor Campbell, if you have any opening statements.
Thank you, Councilor Arroyo, and thank you, Councilor Braden. Can you hear me okay?
Yes.
It's acting up a little bit. Okay. And thank you, Councilor Braden, for hosting this incredible conversation and hearing. It's very important. Look forward to learning from those who are participating in the panel discussion. I've met many in other work that I've done with Councilor Flynn on the issues of domestic violence, sexual assault, and child abuse. And sadly, with new stay-at-home orders and requirements that folks not only stay at home, but socially distance or physically distance themselves, we know that there is an uptick in domestic violence cases and calls. There's real concerns around incidents of child abuse, and adding, of course, additional stress and fear and anxiety exacerbate how people are feeling. So I'm here to listen, to continue to think about how I can support the providers. And then separately, at a more appropriate time, Councilor Flynn and I, of course, absolutely look forward to picking up the work that we started that was really powerful with many of the providers who are participating in this hearing. So thank you so much for the work you guys are doing every single day. Thank you, Councilor Braden, for the conversation. And thank you, Councilor Arroyo, for allowing a few remarks.
Thank you. Councilor Sabi George.
Thank you, Chairman Arroyo, and thank you all for being here today. I look forward, certainly, as my colleagues have shared, to today's hearing and to the work that's underway and is left undone. I have a particular interest in how possibly our schools, we know that our schools play a really important role when we think about domestic violence, in particular because many of our students are carriers of that information and also often victims. And because school is out of session, it certainly has impacted the way that our residents are able to access care and services across our city. So look forward to the hearing, look forward to the public testimony and the work that remains undone. Thank you. Thank you to the maker.
Thank you. Councilor Wu, if you'd like an opening statement.
Thank you, Mr. Chairman, and thank you to the lead sponsor for her leadership on this. It is yet another example of issues that our communities were confronting prior to COVID, which have now been given extra intensity because of the pandemic. And so I think it's so important that the council is exercising our role as providing a platform for the public to have these conversations and to offer some of that oversight as we talk about this issue, which will certainly be an important part of the recovery long after even the public health pieces have been resolved. So I'm grateful that we're having this conversation, and I'm very grateful for the leadership of both of you. Thank you.
Thank you. And so with that, for the panelists, those are the counselors that are here now that will likely be asking questions. I'd just like to thank all of you for taking the time to be here. The way that I'm going to do this, it's a little different. Unfortunately, so many folks came in at the same time. I can't necessarily track the order of appearance, but here's how I'm going to do this. I'm going to introduce everybody, his name and title, and then I'm going to allow you to take 5 to 10 minutes to essentially answer what the prompt is, or whatever it is that you feel is important to bring to our attention. And then after everybody's gone, the counselors will once again ask questions of you individually or as a group. And if you feel like that would be an answer or question that you would like to answer, please do jump in. And so here's what we're seeking from this hearing. If you can give us just an update as to what's presently being done within your organization, what are the short and long-term action plans for the social impacts of COVID-19's pandemic response measures concerning domestic violence, social isolation, and mental health. What are resources that you'd like to make available, or resources that you are seeking from the city, state, or federal government, and however we can be helpful? And what are ways that the council and the city can partner with your organizations to really do the work that is required of us? And so with that in mind, I'd like to now just introduce who we have here today. We have Stephanie Brown here from Casa Milna speaking. Katie Santiago Taylor from the Boston Area Rape Crisis Center. Helen Conley, who's a registered nurse at the Alston Brighton Substance Abuse Task Force. Jennifer Tracy from the Mayor's Office of Recovery Services couldn't be here, but did submit a letter. Vijay Dalal, who is at Granada House, is here. Janet, and I apologize if I mispronounced this, Janet Sekel Sorati from Friendship Works. Fatima Watt from the Franciscan Children's, Director of Outpatient Behavioral Health. Deb Collins is here from Brookview House. Dawn Sama from the Asian Task Force Against Domestic Violence, and Charlene Luma is the Chief of Victim Witness Advocates from Suffolk County DA Office. And I don't believe she's here to testify. I believe she's just here to listen, but Amanda Teo, the Chief of Staff to District Attorney Rachel Rollins is also here. And so with that, I'm going to start with the order of the way that it was written up on the list, and that starts with Stephanie Brown from Casa Milna. If believe you can unmute yourself, or I can unmute you. If I can find it. There we are.
All right, should I just start?
Yeah, just basically, if the questions that our service prompts serve their business, you can use those, or if there's something else you came to speak on, you can speak to that.
Okay, I think everything I prepared was in your prompt, so I think we're good. So good afternoon, everybody. I'm Stephanie Brown. I'm the CEO of Casa Mirna Vasquez. We believe at Casa Mirna that every relationship should be safe and healthy. So to that end, we provide intervention, prevention, and awareness to end domestic and dating violence. Each year we provide support through shelter and housing programs, reaching community advocacy, children's services, counseling, economic stability supports, and legal advocacy. We reach about 1,800 survivors a year in Dorchester, predominantly in Dorchester, Roxbury, the South End, and Mattapan. In addition to those services to survivors in Boston, we also answer over 29,000 calls a year to SafeLink, which is the statewide domestic violence hotline that we operate. As you know, because you called for this hearing, this pandemic is making a very bad situation much worse for domestic violence survivors. The isolation and social distancing that we are exercising as a community and as a nation to keep ourselves safe from the spread of the virus is putting survivors at increased risk. While the pandemic will not cause domestic violence, if there wasn't already an underlying abuse there, it will cause all forms of abuse to escalate. And by abuse, I mean, abuse within a domestic violence context is not just physical. It can be emotional, psychological, sexual, and financial. And those repercussions can last a lifetime. Survivors may be trapped with their abusers, at this point unable to reach out for help or to leave. As Council President Janey and Councilors Mejia and Asabi George said, most of the opportunities survivors have to connect to safe resources are gone. Survivors are no longer able to access support confidentially from work, from school, through their healthcare provider, through their faith community, or even by going to court. They can access their healthcare provider, they can access court remotely, but they can't get away to have a safe, confidential phone call if they're living with their abuser. So they are unable to reach out for help when the abuser, typically they would reach out when the abuser was out of the house, and that's not an option for them now. So finding space away from their abuser to make a call for help is difficult, and making a plan to leave is nearly impossible. So to adjust to this new reality in which we find ourselves, Casa Mirna has changed the way we do our work so that we can continue to reach survivors. Most of our staff are working remotely, except for our shelter-based staff. But so we are still open, and our staff are still working at full capacity and actually beyond. So we are available to help when anybody needs it. Our shelters are open. Our community-based advocates, which is the bulk of the work that we do, connect with survivors over the phone and email, and they are out delivering food and gift cards and supplies for children and any other necessities that households need that they can't get themselves. We're helping survivors who have lost their income to pay their rent, to pay for car insurance, buy food, medication, and other necessities. In fact, we actually expect to provide over $450,000 in direct financial support to survivors over the next 3 to 4 months. So we got support from the Boston Rising Fund, Boston Resiliency Fund, and then we're using any other funds that we can get our hands on, moving around our budgets, and so that we can provide that direct support to survivors when they need it. Because we're finding that really that's one of the critical elements that they need at this point. While calls to SafeLink, the statewide domestic violence hotline, are down because so many survivors are trapped with their abuser and don't actually have the opportunity to reach out, the calls we are receiving are finding survivors more desperate. They're more desperate for emotional connection and a supportive ear, which you all have said. Isolation is a hallmark tool of abusers, and in their efforts to control their victim, they isolate them emotionally and physically from their supports. And now survivors find themselves similarly isolated due to the pandemic. This is triggering, it's traumatic, and if they're living with their abuser, it's much more dangerous for them. The time that our SafeLink and our community advocates are spending with survivors has increased 3 to 4-fold. And so they're not actually supporting fewer people, they're just spending a lot more time to do it. What might have been a 15-minute call to SafeLink has turned into an hour. What might have been a 1-hour check-in with a survivor with a community advocate has become a 3-hour conversation. So our advocates walk around with headsets on and they talk to survivors where they're doing their dishes and they're preparing dinner and they're doing laundry. So it's just constant for them. So we're bringing other staff in who we decrease the number of staff we have working in shelter to minimize the number of people coming and going. And so we've reallocated those staff to provide more support to folks in the community so that we can reach those needs. So our staff are busier than ever, but they're committing to keeping up with the work as long as survivors need them. So I work with an amazing group of people and I'm just really proud of the work that they all do. With the escalating abuse and social isolation, survivors are more desperate for a plan and resources to escape. As you know, domestic violence shelter is limited in scope and availability on a good day. Domestic violence shelter is always full. Typically, survivors might escape to friends and family if shelter's not available. Due to COVID-19, those same friends and families are now hesitant to take somebody else into their household due to physical distancing. So to be able to help survivors during the pandemic, Casa Mirna has rented short-term apartments in which to move survivors who are living with their abuser who need to escape. So we've rented 10 apartments and in the course of a week and a half, they're almost all full. But the one thing that we're worrying about now is what happens when the pandemic is over and the rest of us return to normal. The shelters will still be full and those survivors won't have any place to go. So they'll be forced to choose between homelessness and instability and returning to the abuse, which leads me to what elected officials can do. So we definitely need not just city council, but we need state and the federal government to prioritize long-term housing solutions for survivors of domestic violence. We can start with permanent affordable housing solutions for those survivors who escaped during the pandemic and then grow it from there. We need to continue to support families and small businesses that have lost income due to the pandemic, particularly those from Black, Latinx, and Asian communities and immigrants. The impact of the pandemic is much more severe on them, and that's not news to any of you. I have to say, most of my family lives in Florida, and I am just thrilled to be able to talk about the work that we're doing in Boston and Massachusetts around social distancing, making sure people have access to, or trying to get people access to testing, and so the financial support that we have for survivors and other folks affected by the pandemic. But we have to continue doing that and do more. We could really use elected officials to help get the word out that domestic violence organizations are still providing support, although remotely. So in all the information that you release about resources, please direct survivors, their friends and family, and others to SafeLink. Help us get SafeLink's number out to the public so survivors and the people that care about them know where to turn for help. We all know the responsibility for supporting survivors and ending domestic violence lies with all of us. So I really appreciate and we thank you for bringing attention to the critical and often overlooked issue. So thank you.
Thank you so much for that. I'm now going to call on Don Sama from the Asian Task Force Against Domestic Violence. You're now unmuted.
Thank you. So Stephanie, that was excellent, by the way. And I'm going to second a lot of what Stephanie already said and then kind of take a sort of culturally specific angle. So thank you, first of all, to the chairs Arroyo and Braden for the opportunity to testify on such an important issue. My name is Dawn Salma. I am the co-executive director of the Asian Task Force Against Domestic Violence. Little context, Massachusetts is one of the top 10 states with the largest limited English proficient and LEP population, the majority of whom live in the greater Boston area, 24% of LEP speakers are Asian ethnicities. And there are 74 different languages spoken in Boston public schools. 32 are Asian languages and dialects. Most information available to residents are English dominant and unavailable to LEP speakers. ATASK is a statewide NPO that has been serving Asian victims of violence in Massachusetts for over 26 years. 95% of our clients require some form of translation and interpretation, not just for DV services, but to access any services. So language-based marginalization has existed before COVID-19 and has only amplified under COVID-19. Despite the expected increase in DV, we have experienced a decrease in calls and requests for services. Traditional avenues of safety and access to legal rights, culturally specific and LEP services just aren't available. We are seeing that victims are opting to stay with abusers even in high-risk situations because they feel they have no other viable options. Clients of ours have also returned to abusers, weighing the consequences of abuse versus the consequences of contracting COVID-19 in shelters. These realities only speak to our pre-existing clients. For unidentified victims who are unaware of services and haven't yet accessed a safety network, COVID-19 circumstances such as closures, physical and social isolation, the majority of online and telephonic services only being in English had made former lifelines almost impossible to reach. And since the pandemic, we received no new clients, and this is unusual. COVID-19 response measures have amplified the lack of language support for LEP residents. We are still operating, though remotely, and our shelter is still open. We employ staff from over 10 different countries and territories who are fluent in 20 different Asian languages and dialects. The majority of their time is not spent on DV-related issues, but on translating and interpreting such as preparing English-only documents, translating web pages, and providing step-by-step guidance for English-only websites, attempting to decipher inaccurately translated documents that have been sent to clients, and trying to set up three-way conference calls in order to interpret for English-only providers. Advocates are also trying to both learn and explain information about unemployment insurance, public benefits, the moratorium on evictions, court-related updates, immigration issues, and COVID-19 updates that are predominantly in English. There is also an issue that is unique to the Asian population. Open xenophobia and racism straight from the top down, including President Trump calling COVID-19 the Chinese virus, has incited hate crimes and verbal and physical attacks on Asians in public and on social media. So while residents are recommended to wear masks to protect themselves and others, for Asians, wearing a mask can open the door for open discrimination and attacks. The cumulative impact is fear. Fear of going out into the public or into a hospital or a healthcare setting to get tested and just being judged or blamed for the coronavirus. Several staff of mine have said it's just not a good environment for Asians to be out there. And can you imagine just feeling like that? So the layers of isolation have damaging effects on individual mental, emotional, and physical well-being, not just for clients, but for our staff as well. So in closure, I do have a few suggestions and definitely seconding Stephanie's, but so one of them is that when traditional pathways for safety and information are eliminated or don't exist, the media and public forums such as this are absolutely wonderful alternative channels for disseminating information to the public, where family members, neighbors, community, and the closest to the victim can inform of available services. Also, victims from marginalized populations and communities may be more comfortable calling an organization with staff that they can identify with and or that speak their language. And there are several in Massachusetts that we can highlight through these forums. One, of course, is ATASK. We also have Saheli serving the South Asian population, MAPS for the Portuguese Alliance, Massachusetts Alliance for Portuguese Speakers, the Network Red serving the LGBTQ/T, SM, and polyamorous communities, all have their 24-hour helplines. Jane Doe Inc. is also a great resource and lists all member programs in Massachusetts. Secondly, mass.gov is a central hub for information on resources and services for all residents in Massachusetts, but is only accessible via Google Translate in 12 languages. Google offers way more languages than that. It wouldn't be difficult to add a few more languages as other states have, or all the language which other states have. Secondly, the state's language access plan rests on the shoulders of a handful of cultural and multilingual providers, CBOs and NPOs, who provide expert translation and or interpretation on behalf of Massachusetts residents seeking public services that are delivered predominantly in English. Moving forward, I think we can find a better way to disseminate information and deliver services that are more inclusive. Looking inward, there's a great degree of cultural and linguistic expertise and institutional knowledge that could be better integrated into the fabric of our systems rather than just used to fill the gaps in the systems. Thank you so much.
Thank you so much. The next panelist, Katie Santiago Taylor from the Boston Area Rape Crisis Center.
Hi, thank you. Good afternoon, everyone. My name is Katia Santiago Taylor, and I am the Advocacy and Legislative Affairs Manager at the Boston Area Rape Crisis Center. First, I want to thank you, all city councilors, for this opportunity and for raising awareness about the critical needs of survivors. BARC serves 29 cities and towns and is the only rape crisis center in the city of Boston. We serve all survivors of sexual violence age 12 and older, and regardless of when the harm was done to them. As the only rape crisis center in the greater Boston area, historically, our request for services is high, and we provide services to close to 40% of all survivors, sexual violence survivors in Massachusetts. It is important to note that while sexual violence and domestic violence do overlap, they are also very different. Sexual violence can be experienced as part of domestic violence, and it can also be experienced on its own, outside of the context of a pattern of abuse in a relationship. Sexual violence is often done in many other situations, such as by an acquaintance, family member, not in an intimate partner, or at work. And in particular, many workers in the service industry, hotels, restaurants, experience sexual violence. During this pandemic, BARC has major concerns have increased in certain types of sexual violence: child sexual violence, abuse, sexual violence as a component of domestic and interpersonal violence, and sexual harassment towards workers in an environment where the Me Too gains for oversight and accountability are likely being sidelined. And we're also concerned about more sexual violence and harassment moving online. Survivors of sexual violence typically are isolated. They experience shame, fear of not being believed, and being blamed for what was done to them. This in turn leads to survivors often dealing with the trauma of the violence alone. Now, during the pandemic, the current pandemic, the need to physical distance can lead to survivors feeling even more isolated. And the financial impacts related to the experiencing sexual trauma can become bounded by the financial impacts of the pandemic. As COVID-19 began to spread, we saw an increase of requests from survivors for support around food, housing, and financial insecurities. Many survivors need basic needs met in order to move forward in the healing from sexual trauma. We're talking about a population that is dealing with major trauma, and now they're experiencing an unknown, like a completely different trauma, and having to deal with it while isolated, while in the same space with abusers, with other family members who are blaming them for what happened to them. So that all can increase to their mental health, and they will eventually need more support. So what we are finding is that people are most likely going to reach out for support around the issues that they feel needs the most immediate support. When we're thinking about housing, economic stability, food. So what we're trying to do is increase our efforts and to provide all of our services remotely. Our hotline services are 24/7, and we have continue to see a steady number of calls. Our case management program continues to help people with housing and receiving other type of benefits. And our legal advocacy program continues to support survivors to try to figure out how to meet their criminal legal needs if they have any questions. So what I will ask is to continue raising awareness of all of the resources. Like Casamirna and ATAS, we are providing our services. We're just moving remotely. So any awareness to be brought about all of our services will be critical so survivors can continue increasing our services. And lastly, I will also say, I will echo some of the work that Dawn is doing. I think when a lot of the policies are established, like telehealth, telemedicines are being established with one framework, and they're not including linguistical capacity, they're not including about safety planning with survivors of domestic violence through telehealth, telemedicine. Are you asking any questions? Like, do you feel safe at home through telehealth? That can expose a survivor into a lot of danger. So I would like to continue thinking about the linguistical capacity so that framework is brought to all and any services that are continuing to be provided. Thank you.
Thank you. And apologies on the mispronunciation of your name.
Oh, I get Katie, Katia, Keisha, I get it all.
Got it now. I just need to note that Councillor Edwards has joined us as well. Next, Mr. Vijay Dalal, I hope I pronounced that correctly, from Granada House.
Sure, thank you. Can you hear me okay?
Yes.
Yeah, you pronounce it exactly right. So wonderful, thank you. So Granada House is a residential program for adults going through active recovery from substance use. We are located in Alston, Brighton. We have a transitional house also, along with the residential placement for these adults. So when they graduate from residential placement, we have them placed in the transitional house before they get ready to be on their own. The clients who come to us, the adults who come to us, they come from more restrictive setting to us, and which would be CSS, TSS, or detox program. And they come to us, and our job is to prepare them for community-based living after this. And with all these things going on, this very important function of incorporating them back into the community has been put on hold. You know, this adults who come to us, they come with history of very high risk behaviors. It's not only the addiction is the only issue for them. There are almost every one of them come with another mental health diagnosis. With this lockdown that is happening, and they've lost their jobs, they've lost their connections with their family. They've lost a very important part of their life is also attending support groups like AA and NA. They've lost that also. And as a result of all this, you know, the substance use issues that they are facing with the recovery process they are going through. On top of that, their mental health issues have intensified. So depression, anxiety, we are seeing it more. We are seeing effects of isolation, suicidal tendencies, impulsive behaviors. We are seeing that on a rapid basis increasing. We increased staffing to provide more support to them as much as we could within our funding, but this funding is limited. Fortunately, I received a message this morning that Mass Health will increase 10% of reimbursement for clinical rate, and that would be helpful to increase staffing to provide more support to them. These people are already facing a lot of stigma, and now, you know, with isolation, with losing connection with the community, now going back into the community, there's a lot of anxiety about that also. Is that how they're going to go back over there? You know, they're already had many disruption in their work history. Now there's another disruption that happened. How is that going to happen for them? Another thing is that AA and the support groups are very important part of their life. And right now, everything has been shifted to something like this, working over virtual meeting. But it's not the same for them. Many of them are feeling really anxious that the personal connection that they had within the same space, sharing with another person who's going through the same issues, was very helpful to them, and that is not happening. Another thing is that many therapists are providing online therapeutic intervention, but from the client's perspective, it is not the same as sitting in the office or meeting with a therapist in person somewhere else. So that is also creating a huge issue for them. So we're seeing intensity of mental health issues, and it's like a ticking time bomb with this very high risk population that we have. So what do we need? I think out of this is there's a new normal that's coming out, and we don't know what this new normal is going to be. Things are not going to be the same that were before. We don't know, but so slowly we're getting that idea about what this new normal is going to be. So I think it's time that, when you have, give it an example, is that when someone is lost, we are not able, people are not able to find it. The first they do the rescue mission, and once it is determined that this is what the outcome is going to be, then it's more like become recovery mission. So we need to shift as government offices and as providers. We need to shift to that new normal, what that new normal is going to be, and start preparing our client for that. As a provider, we need to start preparing them for the new normal. As government agencies, as funder, also we need to start investing more in preparing for that new normal. So for example, is that AA meetings are typically run in basement of a church or a community organization. Now, if for next 18 months or something, we're going to have to maintain the social distancing, that space is not going to be available. That space is not going to be enough for them. So I think at that time, we need to take a look at, providing this. These are self-funded, self-run support groups. So opening up for Boston City to opening up is that, if AA and they need any support for adding more space for their meetings, when there comes a time when people are going to be able to go, but they're going to have to maintain 6 feet distance, then, they can approach you and get some help in that direction. For providers also, I think the new normal that is going to be is that, helping especially this community, the community that we deal with on a daily basis, is that change is very hard for them. So I start preparing for that change, is that how that change is going to look like. We're surviving, so this change is in future, this is how it's going to look like slowly. So start preparing them for that. Everything is going to change. So I think focusing a little more on helping people who are going to be affected greatly by this, and for them change is difficult, to start helping them to go through this process. I think it's very important. These are the few things that I see is, I think we're spending a lot more time than what we used to do before in helping our residents survive this crisis. Compensation that our workers have is only minimum wage or a little more than minimum wage. And I know that they're putting a lot more into that. So maybe there comes a time when we need to take a look at the rates also, rates of reimbursement, and see if, more payment could be made to programs like this. So we can pay our staff who are working very hard. Like in each nonprofit, you're gonna hear it, that staff is working more than what they used to do before. And people go into nonprofit field to, for goodness of their heart, and they want to help someone, but we also don't want to take disadvantage of them. We want to compensate them for their extra work. Thank you.
Thank you so much. Next, Helen Conley, a registered nurse at the Alston Brighton Substance Abuse Task Force. There you are, you're unmuted. And now you're on video.
Thank you. Thank you for inviting me to represent the Alston Brighton Substance Abuse Task Force at this hearing. I am the Executive Director for Alston Brighton Substance Abuse Task Force, and we're in the midst of changing our name because we don't want to call it substance abuse anymore. And substance use is really the preferred language. So forgive me for not making that known. I've been with the program for approximately 14 years. We are a collaboration of many community stakeholders comprised of, educators, law enforcement, treatment, personnel, certainly recovery. VJ is actually a member of our task force, and Councilor Braden's a member of the task force. So we all come together on a regular basis to assess what the needs are regarding substance abuse use, mental health in Alston Brighton, and how we can address those through certain evidence-based strategies. We do rely on our partnerships to deliver the strategies that we do because we're a staff of 2. And it's worked very well through grant funding on the local, city and state levels over the years. We're also supported in part by St. Elizabeth's Community Benefits Department and Mass General DON and the Boston Public Health Commission under a grant that we received as a substance use prevention collaborative member with the Office of Prevention under the Mayor's Office of Recovery Services. So, what do we do? Our primary focus is prevention. So we'd like to, we seek, I should say, to look at how we can prevent substance use and abuse, particularly among youth. When we first started out, which was, in 2004, we had a federal grant and we were very focused on Alston Brighton youth because we needed to provide data on local trends and local zip codes. We have over the years expanded and, we provide our services to youth who are from all over the city of Boston because they attend school in Alston Brighton. And so many of our strategies are focused on those youth and on most recently in the schools, the public schools, middle school grades this past year. We have our own youth coalition, which is comprised of about any time around 16 to 20 members who are youth who receive stipends, and they help to develop a lot of the strategies that are provided for the youth. They offer input. They, they set us straight on what, youth need and want and think, and how to respond to youth needs in the community. And so the youth members really are a major feature of what we do because they also represent youth from all over the city. Because to be a member, you need to either live in Alston or Brighton or attend school there. And they help with the Walk for Recovery, the annual walk that we have. They help with a lot of campaigns like, prescription drug takebacks and, getting messages out to their peers. So we work in a workshop-based model this past year. We had our youth coalition members have developed these workshops based on evidence-based strategies on topics related to alcohol, marijuana, and vaping, because those are the primary substances of use that are affecting youth today. Nobody's a stranger to the fact that, marijuana has become very popular amongst the youth group because it's accessible and it's also perceived as very low risk, so that the harm factor there is really gone down. And when that happens, use rates tend to go up according to research. Also, I think we have relaxed social norms about marijuana, and youth definitely respond to what is going on in the community, in their families with adult models. So we are seeing an uptick in marijuana, uptick in vaping, particularly the e-cigarettes, where the youth have been found to be smoking marijuana through the vaping apparatus. Prescription drugs, we definitely address prescription drug use, but we're seeing a downtick in youth prescription drug use. But it still exists. It's still a major problem, but it's mostly seen in the older population, older youth population, and college age students, particularly even in the the athletic arena. And so those are the areas that we look at when we're talking about how to prevent drug use and abuse in this age group. And by doing that, we look, and how we do that is that we look at we look at the risk factors, which many of these risk factors have already been identified by the other panelists, mostly speaking about adults so far, but the youth, what we are finding, not just in Austin Brighton, but across the city, they're suffering from their own, COVID-19 induced anxiety, social isolation, grief, grief at, loss of school time, loss of routine, loss of seeing their friends, playing sports, loss of, relating to or being able to talk directly in person with adult mentors, role models, such as guidance counselors at school. They're also grieving the loss of after-school programming, and certainly their activities, which include sports and all other, various activities. Some students, some, youth are experiencing loss of a parent to this disease of COVID-19, and certainly, fear for their grandparents, who we all know are, really participating in raising youth these days because of the, the need for parents to be out of the house and working. So there's a lot, youth have a lot on their mind, to put it, succinctly. They had a lot of these issues prior to COVID-19. And again, as somebody on this panel said, all of this is getting exacerbated right now. And, they have a fear of the unknown as well. Like adults, what's going to happen? What's the new norm going to look like? Am I going back to school? Am I going to see my friends? Can I get to college? All of these things. So from the youth mind, it's an awful lot to handle. So what are we doing about that? So we're working with the Boston Public Health Commission right now in developing a social media campaign that's called Cope Code. And this is I think it's a 9 or 10 week program. I'm not running it directly out of the office, someone else is, but it is going to be distributed to youth all over the city of Boston. And they're going to do this through partnerships. So the commission will partner with Austin Brighton, they'll partner with, I believe, Charlestown Coalition, East Boston Coalition, to name but a few. And we will take this program and implement it or roll it out in our respective neighborhoods in the way that we think it will be well received. Cope Code addresses issues like self-care, like how to cope, basically Cope Code, what kind of activities can youth engage in that would reduce their stress? What are they being encouraged to do, talking to adults, or, taking advantage of the online activities that we will be sending in. Each week, they're going to do a challenge, and it will be a specific stress or a stressor. And they have the opportunity, guidance, and some, platforms to look at where they can then, describe, how they might be feeling. Perhaps they will include resources on how to cope with that, and then they're going to send it back. For instance, like to Austin Brighton, it will be to us, and then we will translate it into, some good resources, in partnership with the commission and the other coalitions, and then in the end, we'll be able to, offer something in a package, if you will, for coping strategies for the youth in the city of Boston. So we're very excited about that opportunity, and it's coming at a great time. And, you know, our job right now is to, you know, how are we going to get that out? How are we going to disseminate that? And so we're looking at, you know, some of the schools, maybe certainly the partners who participate in the task force, like the YMCA, Charles View Community Center, you know, certainly through the local BPD, lots of partners that we have. So that is something that we're very busy with at the moment. But we're also trying to respond and educate and get information and resources out to parents. Parents are a very important group of people. You know, when they talk to their children and youth about issues like substance abuse or, you know, troubling, you know, mental health issues, behavioral health, you know, research tells us that the youth, they listen to their parents. So we try to encourage that, try to talk to your kids. We you know, send out resources that try to make it easy for parents to plan their discussion, how to, you know, react to what your child is saying to you is very important, because you can, as we all know, if you're around kids, you can lose them on a dime by just saying the wrong thing. So we're trying to disseminate that in those kinds of information. We work with the Austin Brighton Health Collaborative, which is a network of providers in Austin Brighton. And so we're fortunate because we can get information out that way. So in terms of the city, you know, what would I encourage, or we encourage, you know, just continuing to you know, think of, identify ways to be able to reach youth in these times. You know, certainly they respond to social media, they're into Instagram, they're, you know, we want to encourage them to try to stay connected with the people or the places that they had been connected before COVID. For instance, you know, the YMCA programs, the Boys and Girls Clubs, certainly faith-based organizations, if that's meaningful to them. So it's endless, the list that we could encourage. I think the big task here is how to get that to the youth. And so we're trying, and if there's anyone has any recommendations for expanding that, be very happy to hear about it. I'm sure the commission would as well. So we're also engaged in, you know, many other.
If I just cut it really quick, if you can summarize in like the next 30 seconds, so we can, I just want to make sure other folks get an opportunity to speak.
Of course. I get very excited when I get time to talk, because prevention's always been in the back, and I'm so excited to be on a committee that's talking about substance use and public health. It's very important, so thank you. So basically my message succinctly is we need to watch out for the youth. And I'm sure you'll hear from other panelists talking about this as well. But they are, you know, they are suffering too. Any collective efforts that we can, you know, bring about are welcome. And also, I'll just put in a pitch. My final pitch is that, you know, we're always reliant on funding. We need to continue funding, to receive funding in order to do our work. And that's city, you know, state, federal level. And if I hope that is enough, and I hope I haven't taken up too much time.
No, you've been fantastic. Thank you.
Thank you so much for having me.
If we can go to Fatima Watt, who's the Director of Outpatient Behavioral Health at Franciscan Children's.
Hello, everyone. My name is Dr. Fatima Watt, and I'm the Director of Behavioral Health at Franciscan Children's. We are located in the Brighton area, and we're a post-acute rehab hospital. So we're a small hospital that does a lot of different things. We kind of focus on 3 areas of care: medical services, educational services, and mental health services. So on our medical side, we have 2 inpatient units that are for post-acute care. So we see kids that have had accidents, injuries, genetic conditions, various illnesses, and they're here for rehab to kind of get their strength back up. So hopefully we can discharge them back to home. A lot of our kids are on ventilators and have a lot of respiratory issues at their baseline. So we're definitely seeing a lot of stress from parents. We've also greatly reduced the amount of visitors that are able to come into the hospital, both for our medical services and for our mental health services, which has been a little bit stressful for parents. On the medical side, we are allowing one parent to room in. So we have had some parents that are essentially living in the hospital right now. And then on our mental health side, we have a locked inpatient psychiatric unit, and we have a step-down community-based acute treatment unit. We've seen our numbers on both of those units go down significantly. So we're not having as many patients coming in for that inpatient level of care, but it's not because there aren't patients in crisis, it's because parents are really terrified of sending their kids to the ER. And so we've been dealing with a lot of mental health crises on the outpatient side. So on outpatient, we treat kids for a range of mental health issues. We also have our Children's Wellness Initiative program, CWI, that provides mental health counseling directly in the Boston Public Schools. Even though school is closed, we are still providing services to any patients' families that we were seeing previously. And most families are engaging. We're providing that service all through telehealth. We are also providing psychiatry and telehealth. We are seeing about 100 patients a day between our school-based program and the outpatient program and psychiatry. We initially started by only seeing the patients that were already enrolled with us, but we are now starting to take new patients, and we've kind of expanded our ability both for psychiatry and therapy. So if we get referrals from any families where we are in one of those school systems, our CWI staff are managing those cases, and any other cases that are coming, we're managing through our traditional outpatient department, all through telehealth. Our biggest struggle right now is keeping kids safe. Our children that have had problems with depression and anxiety, a lot of their natural resources and their natural supports have been cut off to them. So whether it's a teacher that provided a lot of support, whether it's peers, whether it's other mental health services that are no longer operating at the moment, we've seen for our kids and our families, they're really grieving and they're experiencing quite a bit of loss. Many of our families rely on the school system for meals, just to have their basic needs met. And so that's also been a big hole for some of our families. We have a pretty large Muslim population, and what's happening is that even though schools are providing meals, they're not halal or they're not kosher. And so they're not able to access those programs because of fear of taking in food that they're not supposed to have. And so that would be one resource that would be really helpful, is to make sure that people who have various dietary needs are able to get those needs met from community programs that are feeding families right now. Parents are really afraid of sending their children to the ER. And so we are finding that kids are boarding at home, even though there may be significant mental health issues that they would be boarding in an emergency room. And so our clinicians are definitely working around the clock. We're getting calls on weekends just because parents are reaching out to any lifeline, but they're very afraid to send their kids to the ER, rightfully so. We're limited as clinicians in terms of what we can do in terms of stepping people up. We have this barrier in Massachusetts that a third party has to be involved in order for a clinician to get a patient hospitalized. And I think that it would be helpful not to have that barrier, to be able for the clinician that's dealing with the case to find a bed and to be able to get that patient directly admitted into a unit, as opposed to having to have that child and that parent sitting in the ER for 3, 4, 5 days while a bed search is being done, which risks exposure to them. We're definitely seeing a lot more anxiety, a lot more depression, but even more so in our children themselves, it's the parents that are really struggling. And because our kids get a lot of modeling and examples from their parents. And so they're learning how to cope with this based on how their parents are or are not coping with this. And so we're finding the most amount of distress in the households where parents are not coping well. And so we've started a parent group to kind of support the parents through this. We've also been doing a series of webinars called COVID and Our Kids to provide parents and other caretakers information about looking out for mental health issues, accessing resources as soon as possible, not waiting for the problems to get worse. We're definitely seeing the struggle with routines and with structure. Parents have lost their jobs in some cases or are working from home and also trying to play the role of teacher and doing remote learning. There is a lot of anxiety around school and what's going to happen. We just heard that school is canceled for the rest of the school year, so I'm sure that anxiety is going to increase. But knowing what's going to happen with education services, we have a lot of kids that are on IEPs and that receive a lot of that learning support through school. And parents are not going to be able to be a replacement for that type of special learning that happens. And so having some sort of knowledge about, are kids going to be retained in a grade? Are they going to be just moved forward? A lot of parents are really concerned. My kid only made it halfway through 5th grade. They have all of these challenges. Now they're going to be going into 6th grade. What's going to happen? And so a lot of the anxiety is coming from the unknown. And so as much as we are able to, kind of give information that we have and start to think about the future and plan for the future, I think will lower the anxiety for a lot of people that are involved. For our families that have limited resources, being able to make sure that they have access to telephones and the internet, that's sort of our lifeline right now. And for some families, they don't know how to access that, or they have one parent that has a phone and that parent is working during the day. And now the rest of the family is at home and they have no internet and no phone. So those children aren't receiving the mental health services that they're used to because they don't have the proper technology or the resources. A lot of our staff are still working in the hospital. It's business as usual on our medical floors, on our inpatient psychiatric floors, and our CBAT unit. We're still treating kids. Our teams are still there. We're trying the best we can to practice social distancing, but it's really important that we have proper PPE, especially as kids are going into crisis, as they may become aggressive or activated and we're in close proximity to them. It's really important that our staff have proper PPE so that everyone is staying healthy as best as we can. And one thing that would be helpful is really staying on top of insurance companies and making sure they're reimbursing. We are seeing families, regardless of whether we're getting authorization from the insurance company, we don't want that barrier to prevent us from treating a child or a family that needs the services. So we are certainly getting people up and running as quickly as we can. But for the future of our clinic and of our services, it's going to be really important that insurance companies are reimbursing what they should and not creating additional barriers, either with authorizations or denying claims when we're working really hard to provide the services and to keep everyone safe. I think those are most of the points that I wanted to make. I'm really grateful to be here and to have the opportunity to talk. So thank you so much for the invite.
Thank you. And so as we wrap up on the first round, if we can just adhere to the time limit so that when we have questions, because you are going to be asked questions by counselors, that we have time and space for that. And I'm sorry for the pronunciation of your name that I'm about to do. I hope it's correct. But Janet Sekal-Sarati from Friendship Works. Hold on. There, are you muted?
Yeah, you did great. Thank you. Thank you. Yes, I'm Janet Sekal-Sarati. I'm the Executive Director of Friendship Works. And I guess I'm the only one here on the spectrum working with older adults. So Friendship Works has been around for 36 years, and our enduring mission, ironically, for the last 36 years is to reduce social isolation, improve quality of life, and to maintain the dignity of older adults in the greater Boston area. So the irony of asking everybody to socially isolate themselves has not been lost on us. And we've been dealing with this issue and the psychological and physical impact of social isolation on elders for 36 years. And when we started, there wasn't any academic or research done on what it means when people are alone a lot of the time. In the last 10 or 15 years, a lot of, research has been done. And in the last year, again, ironically, I'd say that the whole idea of social isolation for younger adults, for middle age, and for older people has been in the newspapers before COVID-19. I mean, last year, whether it's the Wall Street Journal, the Globe, the Phoenix, just newsletters about how people weren't connecting. And so here, all of a sudden, we're in the midst of asking people. So we have pivoted. Almost all of our work is about recruiting volunteers. We recruit volunteers, people of all ages and backgrounds, to be matched with an elder who has very little or no informal supports for friendship, support, assistance, going to the medical communities, taking them to hospitals, the escort, not necessarily the transportation, so that you're not alone doing them, doing projects that those of us who are able-bodied take for granted. We do most of our work in Spanish and into English, our two major languages, but we find volunteers who speak all languages, when needed, or have all sorts of things, and take great care in making a match. So, we serve people who, for emotional or physical reasons, need our support, for instance, for the medical escorts, and we're still taking people to medical appointments when there's an emergency. Otherwise, most appointments have been canceled, obviously, except for the emergency ones, but our coordinator is doing that. We are all of our friendly visiting. We have over 400 volunteers, and they now are pivoting to doing phone calls. And we also are finding, and I've just been made more aware how the digital divide is so huge. Actually, the vast majority of the older adults that we serve have no access to internet. And I don't think it's as much age as it is income, because the majority of people we serve are low and moderate income, and being able to afford a phone or a laptop, or and then paying monthly internet things, I think has something to do with income. And I'll get back to that in a minute in terms of maybe what can be done. And I think we see that for children in school, we see that for adults, and how the internet is so important. And people who have the internet, we can connect with them in so many different ways. We have a music program that brings music to people in elder buildings where there's very little activity because music is so visceral, but also because it's a way of connecting with one another and learning about your neighbor. And so the next time you see them, if you've been singing with them or playing drums with them or something, all of a sudden you feel connected in a way that you didn't before in buildings where there's very little socialization and almost no staffing nearby. And we bring pets to people in nursing homes and assisted livings. So the issue of COVID-19, I think, is affecting every single generation. With older adults, they are seeing their peers die at alarming rates. So depending on their mental health beforehand, and I think this is true again for all populations, if people had strong mental health and might be a little easier for some elders actually who have lived through an awful lot of stuff and say, hey, I made it through the Korean War, I made it through World War II, I'm gonna make it through this also, versus those who I think can be strength to younger people. And I wanna get to that before I finish speaking. But then there's those who really do have mental health issues, or who have been living alone for so long. They might have hearing or vision impairment, mobility issues, literally in their rooms cannot leave. People who are living in their own individual homes, people living in apartment buildings, and then those people who are living in elder buildings or assisted livings where they cannot go out to the hallway any longer, and they don't know really what's going on in many ways, and particularly if they don't have internet access or they have any cognitive impairments as well. I did hear of a woman who, for instance, had vision impairment, and she no longer hearing vision impairment. She couldn't get her audiobooks anymore because part of that program had closed down, and she just stayed in bed for the week because she didn't know what to do. A lot of this has to do with homemakers and home health aides, who people are afraid to have them come in. And also those people are homemakers and home health aides who are at the front line. Those who are working and need to work for income are risking their lives. And then also they're incredible, but they're also obviously potentially then going home and then going to an elder's home. So we see caregivers also who now have stopped having, who are responsible for a spouse, those who are not living alone, but are sole caregivers of their spouse, who they're trying to 24/7 be there for them without any support at all in their home, which they did have before. So the stress, the mental health stress on that is incredible for both the caregiver. I'm afraid the caregiver might die before the one being cared for, because they have no support at all, and doing both the physical and emotional things with that. So the anxiety can be incredibly high. You know, if you're in an assisted living or nursing home and know that half a dozen or 20 or 30 people have COVID-19, and then you hear that, you know, your neighbors, you know, 5 of your neighbors just died, you know, last week from it, it can be incredible. The way that we can sometimes be of help is that, and for people to know about this, is that, you know, our volunteers can really play a role with the healthcare community in alleviating anxiety and also physically bringing things to people. We have people who are willing to drop off, you know, groceries or other things as there are in the city. During the COVID crisis, you know, in one of the places we know where there were 5 deaths, the social worker reached out just to make sure the volunteer kept this older adult's anxiety from going, you know, through the roof, and played a big role in keeping it at somewhat of a manageable level. Or somebody else who was at risk of homelessness for not paying rent, that was before this, but wanted the volunteer to be a voice in encouraging people to pay their rent. So volunteers are friends, and they're really our neighbors in a way where we have lost that in some of our communities. I wanted to say that also, that with older adults, we've talked a lot about abuse here and domestic violence and so forth. I think with older adults, it's a lot the opposite, or more of them. About 1/3 of older adults live alone. It's a huge number. So being completely alone 24/7. This is also true for some of our millennials and stuff, who are also really struggling with being alone 24/7. So I think it cuts across generations as well. But for the elders who, you know, are trying to figure out how to, sometimes are not as sophisticated to figure out how to get their food, how to get information, how to know what's next to do, and literally not having another human being to talk to all day long. That we know that social isolation is like what they do to prisoners, you know, to make them, you know, is the worst kind of punishment, is to keep people from, you know, having other human contact. And we see that happening in the elder care community, or in the elder community. Again, some elders are doing quite well, and maybe better than younger people, because they're used to being alone, or they're used to being at home more often and not getting out. But that's one portion of the older population. The other, their anxiety and their physical health is becoming much worse. So
Jen.
some of the things,
remind you, just one more minute.
Okay, so one of the things that I think that you know, folks can do is that bringing attention and cultural messaging that being an older adult is not useless. I think we're getting that a lot from the government and other things, like, okay, if some people die, a lot of them die, that's okay. It'll be, you know, better for society to be less of them. For the messaging that elders are wisdom, bring us wisdom, and that their lives are still worthwhile, so that they're not feeling they're just taking up space, and that people care that they live. I think the issue of internet access, whatever the city can do to ensure internet access for every family in the city, no matter what age, it affects everybody not having internet access. There's so much more we can do in communicating with people, with elders who have that. Also for the counselors, city counselors, to know to refer to us, to know Friendship Works, to know other organizations. We are taking new referrals. We doubled in size in the last 5 years. We're touching the lives of over 1,000 people now, and we're opening referrals up for anybody to give a referral to us. And we're doing due diligence in recruiting our volunteers and doing query checks. So we're matching them very carefully. And one idea I just very quickly will have, and maybe this is offline, but if one of the organizations here who's dealing with youth, if you are not in an extreme situation, maybe we can do a pilot where some of the older adults that we know who are actually doing okay, maybe they can call some of the youth, or vice versa, to give them to support and let them know that they can make this through also. And maybe we can do a small pilot of that, of maybe 10 people, and see how that would help, because those intergenerational relationships can be you know, very important. And I think the elders have something to give as well as to receive it in that way.
Thank you so much, Janet.
Thank you.
We'll be back for questions. Thank you so much for that. I'd like now to go to Deb Collins Gooseby, and then Charlene Luma is on deck, and then it's going to be opened up to the counselors.
Good afternoon.
That's all right. Thank you.
Thank you. So that I'm not redundant, I don't want to repeat again what Stephanie and Dawn have said, but thank you so much for providing us with this opportunity during these very challenging times. My name is Deb Collins Gooseby. I'm the Chief Operating Officer here at Brookview House. Here at Brookview House, we offer residential programming, community-based programming, and youth services programming, including 2 licensed after-school programs and 2 teen drop-in centers in the neighborhoods of Dorchester and Roxbury. While we know that COVID-19 doesn't discriminate, we also know that it disproportionately has affected communities of color and compound already underlying health and economic disparities due to poor health conditions, less health coverage and healthcare access, and socioeconomic circumstances. So I wanted to just share briefly what we're hearing from survivors directly. Our advocates are reporting back that our survivors are feeling even more loss of control during this time of social distancing and isolation. They're experiencing from their abusers extreme power and control. For example, we had one survivor report that the abuser was withholding PPE supplies, so cleaners, masks, hand gloves, hand sanitizers. And our advocate worked with her to be able to get, so that she was able to get to her cleaning supplies by leaving them in the trunk of her car. The survivor left her trunk open so that we can place the PPE supplies in the trunk of her car. What we're also hearing is that there is increased alcohol and substance use, that abusers are withholding insurance cards, and are providing survivors with misinformation about COVID-19. There are loss of jobs and or reduced incomes. Resources are difficult to access and to navigate during this time, especially with systems that are working remotely. A lot of our survivors are sharing with us their concern about food insecurities. They're being overwhelmed, being in homes with abusers and children all day, with limited space for families to separate and isolate. There are limited supplies within the home itself. Then the inability to access community support and resources due to lack of transportation or fear of having to bring all the children out if they needed to access a service, and the fear of public accessing and using public transportation. What we're hearing from the youth and the children that we serve here at Brookview is a feeling of anxiety. They're fearful, they're depressed. They're displaying behaviors that they had outgrown, such as bedwetting. They have lost their sense of routine, stability, and structure. Our children are reporting that they miss school, they miss their teachers, they miss their friends, they miss events such as field trips. Sorry about that, field trips. And plays, they're concerned about missing proms and graduation. Our kids have lots of questions. They're asking questions like, why can't I go outside? Why can't I visit my friends? Why can't I go to school? And we're hearing statements like, I'm afraid to go outside. I'm afraid for my mom who has to go to work. What if something happens to her? What we're doing is that we're telling our children and youth, when they express such concerns, that there are some amazing people working hard to keep us all safe, that it's okay to feel what you're feeling. We acknowledge their disappointment and their frustrations, and we tell them not to panic. We're also providing telehealth for community clinical services to anyone wanting to access clinical needs. That's families, youth, children, individuals. The need is overwhelming. Clinical support for our families and children is critical at this time. Lastly, what I would like to just add is that we're concerned about our staff, and I know that I've heard that someone else mentioned that. Our staff show up every day, committed, faithfully, but they're overwhelmed by their own personal needs and the needs of the families that we serve. They are reporting, our staff, they're exhausted, they're scared, they're sad. They're reporting that they're having issues with sleeping and their eating patterns are off. They have difficulty concentrating. And we have instituted practices and protocols and procedures but we realize that the impact of COVID on our staff, families, and communities will be long lasting. Our ask is that you, as mentioned before, that you let the community know that our programs are here. We're open, we're providing services. Brookview is operating on a skeletal crew, but all of our programs are covered daily. We would also what we also are asking for our families to have access to low income housing, and to keep the pressure on Boston Housing to continue to process and screen all of their housing opportunities. Thank you.
Thank you. And finally, we're going to go to Charlene Luma from the Suffolk DA's office, the Chief of Victim Witness Advocates there.
Yeah. Good afternoon. Thank you for this opportunity to testify. My name is Charlene Luma. I'm the Chief of the Victim Witness Assistance Program at the Suffolk County District Attorney's Office under the leadership of District Attorney Rachel Rollins. I'm also a licensed clinician with experience working communities impacted by both trauma and violence. And I just want to also say thank you for facilitating this hearing during National Crime Victims' Rights Week. It's really important that we kind of acknowledge the victimization that consistently happens throughout the year, and this happens to be the week. We are in unprecedented times. Every single person within our community can be exposed to COVID-19. We are all impacted by it. This public health crisis has created fear, instability, and significant distress for many in our community. COVID-19 not only has physical and medical implications, but also emotional, mental, safety, financial, and overall well-being implication. This is particularly true for the most vulnerable in our community, victims of violence, domestic violence, child abuse, and those with pre-existing serious mental health conditions. Their access to resources may be limited due to physical isolation and restrictions that have been placed on resources that victims typically may have access to. In the Suffolk County District Attorney's Office, we assist thousands of victims every year by providing advocacy, case management, referrals to resources, and support to navigate the criminal justice system. Our primary goal is to ensure that victims are afforded the rights mandated by the Massachusetts Victim Bill of Rights while giving victims the opportunity to have their voices heard. This goal still remains true, but has been complicated to achieve during the pandemic. Victimization still occurs. Children and adults are still experiencing abuse. Individuals are still being assaulted. Crime is still occurring. Trauma is still experienced, and victims still need support. For some, there may be an increase in victimization due to increased physical isolation or social distancing. Restrictions on daily life can be more isolating and dangerous for victims of abuse, especially those whom the only place to go in a household is shared with the person responsible for the harm. Social interaction is often a lifeline. Work and school are often temporary respite from abuse and trauma. There has been a significant decline in reports of both child abuse and domestic violence to our office, and this is raising concern. We believe some of this can be attributed to social distancing, impacting the ways in which individuals can connect to seek help. We recognize that many victims and survivors may be reluctant to report victimization for a number of reasons during this time. In recognition of this, our office has taken several steps to remove some barriers and address the impacts of social distancing on victims. Examples include working collaboratively with the Suffolk County Children's Advocacy Center to create a community safety net guide. So to help those learn about how to protect and support children, working closely with law enforcement agencies to ensure victim rights of notification of when offenders are released, facilitating virtual meetings with victims and forensic interviews with children, supporting victims to access abuse prevention orders remotely in addition to safety planning with victims, addressing any technology concerns among staff to better have access to victims and ensure participation in court proceedings that they wish to attend. We are actively working with our partner agencies to discuss best practices to addressing victims' needs and resources, and maintaining consistent communication with victims and community partners to identify and share community resources that are actually accessible to victims. As the crisis continues daily, so do the members of our office. as the crisis changes daily, so do the members of our office by adapting and keeping victim needs at the forefront of what we do. The current crisis may have changed our modes of interaction, but it has not changed our mission. The members of our office, including prosecutors, victim witness advocates, and partner agencies, are committed to providing a safe, confidential, and victim-centered environment as we navigate this crisis. All of our members of our office are still working. We have a reduced on-site staff, but we are actively working every single day. We will continue to uphold our commitment to serve victims with support, referrals for needed services, and vigorous prosecution to hold perpetrators accountable. Thank you.
Thank you. And with that, I'm going to open it up to the counselors for questions. Just, and I don't know if I notified, but Counselor Bach did join us. And so here's how I would like to kind of structure this. I'm gonna ask my question, but we have 10 people here who've all spoken. We have Stephanie Brown from Casamigna, Don Samo from the Asian Task Force Against Domestic Violence, Katia Santiago Taylor from the Boston Area Rape Crisis Center, Helen Conley, a registered nurse from the Alston Brighton Youth Abuse Force or Substance Use Force Task Force, Vijay Dalal from Granada House, Janet Sekel Sarati from Friendship Works, Fatima Watt from the Franciscan Children's, Deb Collins-Boosby from the Brookview House, and Charlene Luma from the DA's office. And so if you know your question is directed at one of them, please ask for that person to answer it. If you're just directing it to the field, then somebody who feels comfortable answering it can raise a blue hand, raise a hand if you're on camera. I would ask, for the interest of time, that if somebody else is answering the question and you believe that that's essentially the answer you would give, and that there's nothing to add there, that we, in the interest of time, move on to the next question, so that we can get more information out to folks during this time. So with that, my question is for Stephanie Brown from Casamigna. I was a public defender prior to this, and in that work, I'm very familiar with secondary trauma. When we're talking about employees who are taking longer phone calls, more desperate phone calls, and perhaps taking these conversations and having these kind of interactions, and this might be true for other agencies as well, what resources are available or would you like made available to deal with sort of the secondary trauma and the effect that might be having on work that the workers are doing and your staff are doing?
I don't know what sort of outside resources are available other than, actually, no, I think like some counseling or like some drop-in virtual support group might be helpful for staff. Our manager of counseling services actually out on health leave before the pandemic hit. So we haven't had that extra support. So we've done things from, like we're giving staff bonuses who are doing the work. We're trying really hard to make people like keep their hours of 35 hours a week. We also have 4-day work weeks at Casamigna, so we're trying to make people stick with that so they have an outlet. And then we are doing almost all of our meetings virtually by like Microsoft Teams, so that we see each other's faces and sort of have an opportunity to celebrate the good work that folks are doing. So I think the one thing that we could really use is probably maybe some outside person who's an expert in secondary trauma who could facilitate like a weekly drop-in support group or something. I think that would be immensely helpful for folks.
Thank you. That's it for my questions. I'm going to now hand it over to Councilor Braden. On deck is Councilor Janey. Councilor Braden, you have the floor.
Thank you so much. I really, in terms of what I encourage you all to do, we've covered a lot of information this afternoon. I don't have a specific question right now, but I do want to collate all the resources that you folks have and bring it all together following this hearing so that it will be a resource for others. The one question I'd have is just a broad question about how best we can support your work and how best we can advocate for you all going forward. I've got a list here, but please reach out after this hearing and let us know if there are issues that we can and supports that we can advocate for that as a council to support your work going forward. It's incredibly valuable, and thank you for all you're doing. That's all I have to say right now. Thank you.
Charlene Luma, I believe you have your hand raised on this one.
It was for the previous one in regards to vicarious trauma.
Yes, that's fine.
Yes. So, so one of the things I think it's important to remember that, the people on this call may not be like traditional first responders, but we are responders. And so this epidemic has also impacted our workers and our staff. And so because people that are doing the work are also having to tend to family members who've been impacted. So one of the things that we've been intentional about doing in the office is, one, we've provided some trainings and resources in regards to vicarious trauma. It's really important to have consistent communication with staff. So we're meeting, each team is meeting multiple times a week with staff. In addition to just doing general check-ins on how we're doing, we are making sure that our staff are having access to all types of resources, whether it's additional trainings or access to how to you manage during this time. So I think I really appreciate that question, because I think it's something that we have to think about, because ultimately, if we're not well ourselves, then it'll be really hard to do this work effectively.
Agreed. Councilor Braden, do you have any further questions? I see Santiago Taylor has her hand up, so I'm not sure. Let me just.
Oh, I do. It's again to the vicarious trauma question. Just to add one or two things. We do have a community meeting every week on the Fridays afternoon, and then we have weekly check-in with the body system. And lastly, with the COVID, we have for parents who are now forced to be educators, we're also having the ability to take some time off, cover under the sick leave, so we can be able to manage both, be at home and be able to do our work. So we have some time to decompress and to focus on work while working at home.
Thank you so much. Councilor Braden.
Yes, this is a question for Janet from Friendship Works. In terms of supports for elders who are bereaved, like I heard a case today of an elder who is grief stricken because he's lost 5 of his friends who've passed to COVID. Do you have relationships with mental health providers to help with counseling and support, or a referral net mechanism?
We don't, we have, well, we have some people on our staff who actually have our Masters of Divinity degrees, so kind of some chaplaincy type of support that we can do. Nobody on our, some of the people on our staff have social work backgrounds and others do not. We will refer people out when they needed to, either somebody, when usually we get referrals from the community for the matches that we make, and we might refer it back to them, and we do have a list of resources we would call them. And then the other thing is to see if the volunteer who is matched with them, will call a little more often, or match them with a second person, so that they will have phone calls more often, just to let them know that they're not being forgotten, that somebody will notice if they're not there, because that's a lot of things when you're living alone, which is not just during COVID-19, and some of this issue of social isolation is goes on all the time. It's just hidden behind people's windows. We all walk past the streets and don't realize how many people are completely socially isolated. So, but to your answer, we do have some referral networks for mental health, and otherwise on staff, we, if we can, we'll cover it, as the best that we can. I don't think there's enough mental health workers out there to do with it. So we'll train our volunteers. We're doing more training for our volunteers on how to deal with some of these issues of loss.
And further, it sort of links into what our other colleagues are saying about, in terms of support, in terms of the secondary trauma to your volunteers. Do you have a support network for your volunteers then as well, like a peer support, or do you just do that through supervision?
Through supervision, through group emails that we have a newsletter that goes out to the volunteers. But actually, I may take that under advisement, your suggestion there, and find out if others do need that.
Yeah, thank you so much.
Thank you for your question.
Thank you. I see. Let me just unmute.
Yeah, can you hear me now?
Yes.
Okay. So in terms of supporting staff, You said everything that should be said. Providing more supervision is what we do. Also, what was helpful to us is that Councilor Braden knows that we're part of Austin Brighton Health Collaborative, and together all the providers, they decided that they're gonna express gratitude towards Granada House staff, and we received a little gift certificate for each of our staff. And I think it's just from outside sources to get some sort of recognition coming to people who are overworked is very helpful. Another thing which was helpful is that Councilor Braden called to check how we were doing. Rep Hanan stopped by, and when people in public offices, they stop by and they ask and check on staff as to how you guys doing, do you need anything? That is also something that's really helpful. It's just two things.
Thank you. And Braden, Councilor Braden, if you have one more question, then we can go on to the next one and we'll do a second round.
I'll in the interest of time, I'll yield my time and let others have an opportunity to ask their questions.
Thank you so much. President Janey is next, followed by Councilor Mejia.
Thank you so much, Chairman Arroyo. I want to thank you, certainly thank Councilor Braden for bringing this important conversation to the forefront, and all of the panelists for your work. I will be brief and just do all of my questions that I can squeeze in and that can be answered fine. I don't think I will make it to a second round of questions, as I have another commitment. We'll have to jump in, and I will limit my questions. So I have many more, but I know time is of the essence, and many folks, many of my colleagues have questions as well. I'm really hoping to get an understanding of the breakdown of the types of cases, kind of from a bird's eye view, looking more at the entire city. And I'm not sure if any of you have that. There was a lot of information shared during the panel presentation, so apologize if I missed it. I know you guys are tracking your individual calls and cases. I'm wondering if anyone has a sense of what is happening kind of overall in the city. If in fact we are seeing increases in certain categories, what those categories are, and when you're measuring the increase, what are we comparing it to? Are we looking at the previous month? Or are we looking at the previous, the same day on the previous year? And then I'm also interested in what resources or supports do you feel that you need, and how we could best advocate and support the work that you're doing on the ground. Again, I think we recognize many of the folks that you service are some of the most vulnerable in our city. Many of these issues, all of these issues, in fact, exist pre-COVID, but for many are really being exacerbated given the close proximity, the lack of outside access and connection to the outside world. And as I said in my opening, deeply worried about people in abusive situations. But I know there are all kinds of calls. So a breakdown of calls overall, looking at what these increases are, if we really have a sense of the citywide, and then really what supports and resources do you guys need? Thank you, Mr. Chair.
Thank you, President Janey. And so that's kind of an open question. If anybody wants to tackle that, just raise a hand. As far as the question posed to the panel, anybody can. I see a hand there, unmuted. Hold on. There you are.
So, yeah, this is Vijay from CEO of Granada House. What we're seeing is that we usually have, wait list for people trying to get in, and we're seeing that at this time, we stop our wait list at 10, male, female. We're seeing more and more need for people to find displacement. At the same time, there are not enough beds available. So what happens with this population when they are in higher level of services like CSS or TSS, they are not able to find the next step in recovery home, they end up being homeless. They take it upon themselves, they discharge themselves, and you're gonna find them on Mass Ave. Good thing is that BSAS BSAS is our licensing agency, and they made an exemption at this time. They gave us blanket waivers that if you are able to accommodate more than what we have licensed you for, we will give you that option. You know, you can say if you have a room for, let's just say is that if you have a room for 30, but you're licensed for 22, we'll give you that okay, that you can go over your license capacity and can go up to 30 over there. But the issue that comes up is that I did talk to Councilor Braden about that, is that Boston City Inspection Department, they have, you know, building capacity set up for each group homes like this. In our case, you know, we're able to accommodate 30, but our building capacity is set up for 22. Some way of maybe a fire department or inspection department come make a quick visit to say that for temporarily, you know, we will increase your capacity to 5 more residents or something, then we'll be able to take those 5 more residents. You're gonna have five less people walking around on Mass Ave, being homeless or engaged in high risk situation. They'll have a home with us, but we do need that kind of a support, of just temporary increasing the capacity, so we can take care of more people who are, you know, it's waiting in line for us is that someone could die waiting in the line. You know, that's how dangerous it is.
Thank you for that. Is there anybody else who'd like to try and answer that question? Yeah, Don Sama, and let me just unmute you. There you go.
I think this speaks to one of the questions, but I think what we're seeing is just a massive need for income support. And most of our clients, as I've mentioned, are limited English proficient, are in service industry jobs that are just unreliable. And many of them, most of them have already lost their jobs. And so they're concerned about how they're paid to pay their bills now, but they're also concerned about what comes next. A lot of them are considered in that workforce that are expendable and often exploited. So income security, it means remains a major amount of stress. And we're looking at months out that they're not gonna get another job anytime soon, and to be able to support their families. And the ones that we're most concerned about are undocumented immigrants and documented immigrants who don't qualify for unemployment insurance. And those are often the cases that are the 1099 employees, which are in a lot of the service industry jobs. They're contracted. So that's what we're grappling with right now, is how to support them over the next at least couple months. Thank you.
Thank you. Does anybody else want to try and answer that question? President Janey, I do believe you probably have time for another question if you want to ask one more.
Yeah, I'd like to come back to the breakdown, wondering, I know you guys, I believe in your presentation, and it certainly was a lot to digest, and we'll have to kind of go back and listen to some of it. We're talking about the types of calls that you get as service providers. And I think you said in the opening, Mr. Chair, that the person from the administration was unable to join. I'm interested if anyone has more of that bird's eye view around what the numbers are for the city, around the breakdown types of calls. So we got of 100 calls, X% were on domestic violence. One was involving some sort of emergency order with, involving children. There were other types of calls that were maybe around suicide. And then I wonder how we're measuring when we're talking about increases. What is that? Are we talking about what it looks like on March 21st? Or are we talking in February 21st? Or are we talking about what it looked like on April 21st of 2019 compared to April 21st of 2020? So when we talk about increases, I'm just curious as what the measurement was. Thank you, Mr. Chair.
Thank you. And does anybody want to try and tackle that specific question? Stephanie Brown, you are unmute. Yep, you're unmuted.
So I can, for domestic violence at least, I can speak for how Casa Mirna, how we're measuring the increase or the decrease in calls. So we're looking at calls to SafeLink, which is the statewide hotline, plus the calls. We have a community advocacy line that folks can call if they want to talk to a community advocate. And so we're looking at calls sort of compared to a few weeks ago to what we're getting now. So we're sort of looking at from when sort of the social distancing orders came out and people started distancing compared to the weeks previous to that. Plus we can compare to the same time last year so that we're looking at it from both perspectives because it could it's day to day, week to week, like there's always some fluctuation.
Right. And so you're doing both ways. You're looking at pre-COVID and then you're also looking a year back.
Yes.
Are any of you looking at suicide calls and actual numbers? So I'm wondering if we see an increase in calls, are we also seeing an increase in the actual number of suicides? Are any of you measuring that?
Just a raise of the hand if you are.
If you are, and if not, no, I know that we couldn't get every provider in one hearing. And I can follow up with a provider who is. Thank you. Thank you, Mr. Chair.
Thank you. And just to go back to Stephanie Brown really quickly on that question, did you have a number or a percentage in terms of how much your calls have grown in that time?
We have, so I can say that for SafeLink, the hotline, statewide hotline, our calls are down about 15%, but the time that advocates take are up like 3 times the amount of time that
calls last longer
on the calls.
Right, and the access is diminished because women who were going to work had that safe haven, those hours away from the abuser or anyone who was being abused, not just women, no longer have that work telephone and that free time at work to then make that call. So that I think also speaks to the numbers.
Yeah, I think the increases are probably more concerning, frankly.
Yeah.
Janet Seckle-Sarati.
Yeah, I just want to say, just on behalf of elders, that there's a lot of scams going on, particularly to elder agencies having to build firewalls, like additional firewalls. We spent a lot of time a few weeks ago because people are trying to scam elders. So a lot of we're finding some of the same. It's a different range, but spending more time with some of our older adults or needing to make additional matches when we had one person calling them, maybe somebody else. For those who already were in our system, we are taking new referrals, but it's also hard for people to know to trust you because there's so much there. So people who might be in need and who might really benefit and you haven't had contact with them. So who makes that referral, like a friend or family member or city councilor, or somebody else knows them in the building makes that referral. There's a trust there. But if not, it's very, and also it allows them to say, yes, I would like that call. Otherwise, it's pretty scary because these are times when people can really take advantage of that. And that gets in the way of being able to help, particularly older adults who have become very wary of people taking advantage of them.
Thank you for that. Thank you, President Janey. The next 3 folks in line, Councilor Mejia, followed by Councilor Asabi George, followed by Councilor Campbell. And so with that, I'll shoot it over to Councilor Mejia.
Thank you. Thank you all for participating in this conversation. It's really important and I've learned a lot. I do have 3 questions. One is specifically for Stephanie. I'm curious, how are you utilizing, or if there are any opportunities to utilize nonverbal ways to communicate for folks who are experiencing domestic violence, and that is either through apps or text services. Just wondering whether or not that has been something that you have decided to use or even is on your radar. I'll ask that question first, and then I'll move on with my next. Unless you want me to ask all my questions now, Ricardo, what's your preference?
However you feel best.
Okay. So we can answer that question. I'd love to hear from Stephanie.
Okay. So first, sorry, one of my cats always decides around 4 o'clock that it's time to jump on the desk. So he's gonna be walking back and forth. So yes, so we have definitely looked into texting through the hotline, but we haven't implemented it yet. Unfortunately, we were actually looking at it to, we were going to roll it out originally to youth because we wanted, because we know that youth don't call hotline, they don't call anybody. So we wanted to be able to connect them through a chat or a text line. So we are in the process of sort of figuring out what that will look like. We are now looking at seeing how we could ramp that up quickly for SafeLink for anybody. And I think particularly around domestic violence, there are lots of concerns around safety and confidentiality of the information, particularly domestic violence programs who get any kind of funding from government, whether it's state or federal, have to adhere to the Office on the Violence Against Women Act rules around confidentiality. And so we can't do sort of a traditional text. We have to make sure that there's lots of encryption and protection. So we have a service provider that provides that for us so that we're going to see if, over the next couple of weeks, we can roll that out. In the meantime, our community advocates who are already working with participants, they do work with each other by text or email because they've already established a relationship and our staff know that it's actually the survivor that they're speaking with. But it is much harder for folks who aren't already connected to a support to connect through that way. But BARC actually does have a chat line. And so they were one of the examples that we were looking at around seeing how we can connect to survivors through a text or chat line. But very good question.
Thank you for that.
Just before, I'm sorry, but I see a hand, so I didn't know if you were aware, but Katia Santiago Taylor from the Boston Area Rape Crisis Center, I believe, wants to also try to answer that question.
Sorry, I was just going to mention that BARC does have a online chat line. They service 9 a.m. to 11 p.m. every day. And we do see a lot of survivors reaching out through that way, has been very helpful. So it's a resource available for survivors.
Thank you for that. And then the next question is a little bit more general. I'm wondering what opportunities, if any, and if you all as providers have a task force that you're all working collectively. It seems like everyone is doing an amazing work. Just curious in terms of what your network looks like in terms of collaboration and information sharing. Does that exist within this context here, specifically around the COVID-19 situation that we find ourselves in? Has there been an opportunity for you all to work across industries, if you will?
I'm gonna go to Vijay Dalal, whose hand is up. You're unmuted.
Thank you. So yes, there's a good network, especially in Austin, Brighton area. So it's represented by 2 people and 3 people over here from the area, and it's we meet twice a week. We have a webinar. Not really webinar, it's a conference like this, and we discuss what resources are available, what changes are happening, what updates from each program, what our needs are. We support each other, so I think that's wonderful. In recovery homes, we have once a week, we have our advocacy group, that's Recovery Homes Collaborative, and we meet the same way also and discussing more about issues which are going on through each other's programs and how we are dealing with that. So there's informal groups which are happening. I think in Austin Brighton area it's very active, and there's a great amount of support and connection with providers, and thanks to our very active city councilor and state reps. They also take part in each one of those, and they provide suggestions, and they provide any resources that they have found, which we may not know about it, and they give us those information. So, yeah.
Thank you. And just to kind of follow up, I'm curious in terms of nonprofit organizations like Teen Empowerment, and there are other youth servicing organizations that are also doing work engaging young people. Just wondering whether or not we're looking at this conversation around mental health, domestic violence, and trying to figure out all the different places where young people and or people who are seeking services we're touching different people in different times. I'm just wondering, even this includes local businesses. I know a lot of them are closed now, but I'm thinking of little convenient corner stores. Like, what opportunities are we looking at having this conversation from a community-centered approach, where we're engaging people in a number of different ways to help amplify the work that you all are doing and or engaging people in that process, so that we're engaging as many people as possible. It's just something to think about in terms of a strategy for engagement that I think might be helpful to consider and explore as we continue with this dialogue. The other question that I have is, I'm curious about whether or not anyone in this conversation here today can talk to me a little bit about the work that's being done to reach out to seniors and the LGBTQ community. Just wondering who can speak to those two different groups.
Janet, I see your hand up.
Yeah, regarding seniors and LGBTQ groups, together, actually, we are working. We started some really good conversations. We had some before. We had built, had some relationship with LGBTQ Aging Project, and Friendship Works and the LGBTQ Aging Project are looking at doing a more formal collaboration. They don't have the staff that we, or the resources of volunteers. They're a very small group, but they do incredible stuff. All the lunch programs that they used to do and everything that now no longer exist. So we are, anyway, we're partnering with them to reach out, to make matches, to do telephone reassurance matches, to do friendship matches that then hopefully will last beyond this time period also. But we're doing some planning and having like weekly calls or something now. Just as a little while ago, we had started doing some work with LG. It's one of the focus areas that we are particularly interested in, and did a LGBTQ intergenerational storytelling group a few years ago, and are building our medical escort program to take people who are LGBTQ to medical appointments, knowing the sensitivity of some issues regarding to health that people don't always trust. So we are working around that. I will say we're doing it in Boston, Greater Boston, and then there's a need for it throughout the state as well.
Yeah, thank you for that. And then the last question that I have, and I'm more for recommendations, less questions, because you guys are doing amazing work. Because I know my mom is 71 years old, and 3 weeks ago she was laid off, and she's been extremely depressed. And everything that we see on the news is doom and gloom. And so we've been trying to, at home, do more yoga with her and really teaching her about self-care, even though she's much older. That's not a concept that she understands. And so I'm really concerned about our aging seniors who feel disconnected from their loved ones. And so, whoever is working on issues to help support elders, please reach out to my office and let me know what kind of programming is coming out of your office, so that I can share that information and plug my own mom into this conversation. It's important for me. And then the last piece is that I really think about young people who are already in abusive relationships, and the high rates of bullying that we're seeing now on social media, and how that is influencing and impacting the social and emotional well-being of students is something also that is near and dear to me. So whoever is on that front, raising my hand up as, please reach out to my office and let us know how we can help in any kind of way. Thank you, Ricardo.
Thank you. I see no hands on there. Next is Councillor Anissa Savi George, followed by Councillor Bach.
Thank you, Chairman. I missed where I was in order, and thank you everyone for your very thorough presentations and very thoughtful presentations. Some of you are probably aware I've been doing a series over the last few years working with family shelter providers as well as mental health providers, and a lot of your organizations have been involved in that work. And in particular, I'd love to have someone speak, and it's been referenced just a little bit, but I'd love to have someone speak to the impact of domestic violence in particular, and the correlation or the often, it often exists at the same time with homelessness, both individual homelessness and family homelessness. And I know a number of your organizations focus on that in particular. I also know that there's so many we don't have enough DV beds, for example, in the shelter system, so that there's a real lack of services and an ability to access services for too many families. So I don't know if anyone in particular could speak to that, but just in general, thank you for your work, and thank you for all of your staff that are continuing to show up every single day and do this work, because it is so critically important, and we know that it's life-saving work.
Thank you. Any hands on that question? I see none. There we go.
That must be the Brookview House.
Hi.
It is.
Hi. What I would just add to that is that our DV services are community-based only at this time, but we do emergency shelter through the EA system. And what we have found that through our the 18 families that we shelter at Brookview is that 90% of them are homeless as a result of domestic violence. So although they did not come through that particular door, but they were homeless as a result of being a victim of domestic violence. And so we are working with them just like we would, and continue to work with them just like we would anybody coming through our community-based DV program. So we're doing a lot of safety planning. There's still a lot of layering that on top of all the other issues and concerns that they may be experiencing as well. So if either they may have been recently removed from DV, they may be actively involved in a DV relationship, or they may come to us and end up in a DV domestic violence relationship. And so we are advocates that work in our community-based programming, are also working with our families who are living in our residential programs as well, providing them the same level of services that we would anyone walking through our door here in Roxbury.
Thank you so much. Does anybody else want to answer on that question? Yeah. You're unmuted.
I'll just say real quick, thanks for the question. It's a very important one. There's some research that shows that about 60% of people, when they leave an abusive relationship, they become homeless immediately after. So that doesn't mean that they end up in a homeless shelter, but they could be couch surfing with other supports in the meantime. So knowing that, like, we have like rapid rehousing resources through the City of Boston Continuum of Care that we are, putting together to provide with survivors, so that if we can get them into, like an Airbnb for a couple of weeks, or into a hotel for a couple of weeks while they make their plan and look at apartments, then we can get them into an apartment quickly. But you're absolutely right, Counselor. Like, there isn't enough shelter for people to go to be able to sort of sit back and take a breath and make those plans. So we have to do it like while they're living in the abuse through community-based services, or sort of just put them up temporarily somewhere so that they can do that. And at the same time, it's really important that we also have the resources to help people prevent them from becoming homeless. And so, we work with legal services to, if we need to evict the abuser from the home, particularly if they're living in public housing, so that the family that remains, the survivor, and if they have kids, can stay in that unit. But then we also have to safety plan around how they do that safely, because obviously the abuser knows where they live. So maybe it means they need an emergency transfer to another unit. And so I think all of us put together all of our resources to help survivors sort of map that out and figure out what happens next and what are the safest choices and the choices that make the most sense for them and their family. But yeah, we can always use more resources.
Thank you for that. I see Helen Connolly has her hand up. You're muted. 1 second. I'm just trying to. There you go. Now you're.
Okay, thank you. So, Counselor, I was just wondering if you maybe approached this through the lens of substance use, because, I wonder if the Office of Recovery Services has resources. You mentioned a speaker, also beds, because, and also the Graken Center out of Boston Medical, because certainly, substance use, homelessness, and, domestic violence often can go together. And so I just don't know. I don't know exactly what is out of those offices or those places, but I think that's a good place to start.
Thank you.
Thank you, Helen.
Anybody else? Do you have any other questions, Councilor Asabi George?
I don't have any. I really do, Chair and Councilor Braden, for sponsoring today's hearing. The panelists have been really thorough and wide ranging. I think that maybe the one potential missing voice in this conversation, and I know the administration wasn't able to join today, but both the Boston Police Department in their sort of response to families who are impacted by domestic violence and the calls for help, literally and figuratively, the calls for help, but then also the school department, because as I said in my opening remarks, children in our school system are able to access certain services, and families are able to do it sort of in a roundabout way sometimes. So I think that they're an important voice, an important partner in this work. Yeah. But thank you very much. Thank you to both of you for hosting today's discussion.
Thank you, and I agree. Councilor Bach, if you have any questions, there you are. And then it's back to the top.
Great. Thanks so much, Councilor Arroyo, Mr. Chair. And I have to actually really echo everybody. It's been very thorough and very eye-opening. And I think there's a lot of awareness sort of in general of the fact that this is a big challenge that's part of this crisis. But I think you all really helped bring out for all of us the details of it and the sort of like million ways in which your efforts need support from all of us. So I really appreciate that. I had a little question for Dawn, just about whether, I guess one thing I'm wondering about is, there was mention of translation, and just thinking about whether there are specific resources that it would be like very helpful to have the cities like translation folks work on getting like kind of static versions of in a bunch of different languages, or sort of whether you feel like all the stuff that is needed in the main languages spoken in Boston exists, or I don't know, just a little curious for a little more texture on that, and whether there's any way for like the wider translating world to be helpful to you all on that front. So that was my one question.
So thank you for the question. And I actually asked this question to staff, and a couple of things have come up. And I think because there are a lot of our existing clients, the ones that are not in abusive situations and can speak to our advocates, have asked for or asking a lot about, are particularly around just the mass.gov site. Just where is the information, one site they can access that has the information. And we do know that Google Translate is not very good, but it is limited right now to only, I think, 3 Asian languages, none of them which are South Asian. And having just all the languages for all the LEP residents in Massachusetts, I think would be helpful. Even if it's a margin of the information, it's still some rather than no information. The next step, of course, would be finding a better translation. We did start to look into some of those systems as what are the systems that appear to be actually translating well. One of them, I think, was DTA, that had an excellent translation system. So there are models out there that we could use. IRS does the same. Some that have been really difficult are unemployment insurance, which has been incredibly something that's really, really needed right now, since the majority of our clients have lost their jobs and are looking to seek this and are just unable to access without the third person. So the multilingual or bilingual staff person who is able to sit with them and step-by-step go through that process. And it's a 3-hour process per client. And I'm guessing that's for anybody who's limited English proficient who can't access that site. So definitely making those kind of translations would be helpful, and on key sites. DTA expanding the number of languages, CDC expanding the number of DPH, expanding the number of languages. So these are central sites, and just looking to that expansion. And then also platforms like this, and so all of you to be able to get this information out there to your constituents in your area. Maybe on your web pages and saying, hey, here are multiple languages that could, and here's the information and where to seek this information.
Great. That's really helpful. Yeah. So, okay. And it's interesting to know that there are parts even of the state apparatus that actually does the translation better.
Yes, absolutely.
Because maybe that's, a chance to put some pressure. It's sometimes easier to get people to, expand the contract that DTA has with whoever is doing the translation than to start something from scratch. So maybe there's a route for advocacy there. I really appreciate that. And thank you all again so much for speaking to us today.
Thank you.
I just want to thank everybody. Thank you, Councilor Bach. I just want to thank everybody for taking the time today to be as thorough as you were and to present on multiple different fronts. We had 10 speakers today, and that took some time, but all of the information that you gave was very thorough and I think very helpful. At this time, I'm just going to see if there's a second round of questions. I don't know if any other counselors have it, but what I can say is sort of in my own closing here is that congratulations to Councilor Braden. This is her first hearing order, I believe, that made it to a hearing so far. And so I think it's an excellent issue, and it speaks really deeply to your service and the values that you hold. And I want to thank everybody here who did today give testimony, and their staffs. Please do let them know that I appreciate, and I know the city of Boston appreciates the work that they do. And so with that, I'll kick it over to Councilor Braden. And if anybody else has a second round of questions, please raise a hand or turn on video or do whatever, and I'll make sure we get it to you. Councilor Braden, the floor is yours.
Thank you, Councillor Arroyo. I have to just express my very deep gratitude to all of your work, everyone, and all your organizations and all the staff that are working under these incredible circumstances. As many of you have alluded, these issues existed before COVID. They will exist after COVID, but in this moment, it's allowing us to put a spotlight on the issues. Hopefully going forward, we will increase our advocacy and try and address some of these very deep systemic issues that we have in our communities to make life better and to put in safety net structures that will help our most marginalized community members and neighbors. So thank you so much for your work. I'm deeply grateful for all the work you're doing, and do not hesitate to reach out to our offices if you need support or advocacy on any of these issues. Thank you so much.
Absolutely. And Councilor Janey, you would have been next in line, followed by Councilor George, followed by Councilor Bach, if you have any final comments that you would like to make. President Janey. Councilor Asabi George, if you have any final comments that you'd like to make. Councilor Bach.
I'm all set.
All right, fantastic. So with that, I'm going to, Councilor Asabi George, I
No,
see you.
I'm all set. I just didn't want to be rude. Sorry about that. I stepped away from the computer.
No worries.
Thank you, everybody.
And so with that, I would echo everybody's sentiments. I would ask that you please do reach out to us as it's budget season with any requests that you may have or anything that you may need help with or resources. Personally, my office number is 617-635-4210. Please don't hesitate to call. And with that, I just want to say thank you again. We're grateful, and that is this hearing is concluded. We're adjourning now. And so thank you very much. If there is a public comment section, please email Ron Cobb, that's RONCOBB@boston.gov, and then we'll make sure we get that public comment. So thank you so much to everybody here who spoke and who took the time to participate, and to the counselors for their patience. This was a long hearing with a lot of information, and so thank you for participating and being attentive. So thank you.
Thank you. Thank you.
Thank you.
Thanks.